In a world filled with hustle and bustle, where health takes a back seat in the rush of everyday life, there's one topic that's both silent and deadly: diabetes. But today, we're bringing diabetes out of the shadows and shedding light on the power of awareness, self-care, and effective management. We'll hear from the experts, the physicians who've dedicated their lives to understanding the complexities of this condition. Join us as we explore the latest insights and the science behind diabetes management. We'll uncover the myths, reveal the facts, and guide you on a journey towards a healthier, more informed future. Don't go anywhere, because when we return, we sit down with two experts who will empower you with knowledge about diabetes awareness and self-care. This is You and Your Health.
You and Your Health is brought to you by Doctors Hospital Health System.
Welcome to You and Your Health, everyone. I'm your guest host, Alexis Burrows, Marketing Director at Doctors Hospital. Here with me to talk about diabetes awareness, management, and self-care are Dr. Jan Martin, Director, Medical Surgical Weight Loss and Diabetes Program, and Internal Medicine, Diabetes, Endocrinology, and Metabolism Specialist, Dr. Ariane Davis-Simmons. Dr. Davis-Simmons, Dr. Martin, we are happy to have you on the show today.
Thank you for having us.
All right. So let's get started. Dr. Martin, can you provide an overview of the current state of diabetes awareness and its impact on public health?
Sure, I can, Alexis. Diabetes is a disease that is a chronic, relapsing disease for persons who are diagnosed with diabetes. The 2019 Health Survey reports that diabetes in the Bahamas has increased since 2012 to 2019. We have diabetes now is the 5th leading cause of death in the Bahamas. And we have 1 in 7 Bahamians living with diabetes. But not only does the diabetes growth in the Bahamas affect the economic and the healthcare system, it also affects the individual, because the individual is affected not only physiologically, but mentally as well. It affects their relationships, it affects their employer-employee relationships. If they have health care with the employer, it affects the utilization. So mentally, the person is affected overall when they're diagnosed with diabetes, to the extent that the health care is reduced that they give themselves, and they also suffer from burnout, diabetes burnout, if they've been diagnosed for a long time. In addition to that, the survey done in 2019 showed that 55% of Bahamians with diabetes are non-compliant with their medication. So it's a significant impact to the country diabetes has become.
So Dr. Davis-Simmons, you see patients obviously in this space as well as Dr. Martin, but what are some of the common misconceptions or myths about diabetes that you encounter in your practice, and how can we address them?
So there are many myths about diabetes, and this is usually due to internet, social media, old wives' tales. But the most common myths that I see in my day-to-day practice are the first one would be, I don't have a family history of diabetes, so I'm not going to get diabetes. So yes, if you have a family history of diabetes, you're at increased risk. So we know if you have one parent with diabetes, you have about a 17% increased risk chance of developing diabetes. If you have both parents with diabetes, you have a 50% increased risk of developing diabetes. But there are many patients who have no family history and still develop diabetes because there's other risk factors. Older age, so age over 45, so we know diabetes risk increases as we age. Being obese, overweight, having a sedentary lifestyle. In women who have polycystic ovarian syndrome or have had gestational diabetes and pregnancy are all risk factors that increase the risk of developing diabetes. The second myth, I would say, is patients who have prediabetes believe they don't have to worry about it, I'm fine. So prediabetes means blood sugars are abnormal. It's not elevated enough to be called diabetes, but it's definitely not a normal blood sugar. So if you do have prediabetes, this increases your risk of developing type 2 diabetes within 10 years or less. And this is the phase where you can make lifestyle changes. And I would say the third myth that I see very commonly is patients who have been diagnosed with diabetes assume that they're going to develop all of the complications of diabetes. So they believe they're going to develop the kidney disease, the blindness, foot amputations, and this fear can be debilitating, so they don't seek care, so they pretend as if they don't have it. So yes, if you have uncontrolled diabetes and high sugars for many years, it can lead to these complications, but these complications can be prevented through good control of your diabetes.
Could you also explain, and you mentioned prediabetes, type 2 diabetes, can you kind of just explain the different types of diabetes and any specific differences in how those are managed?
There are 4 main types of diabetes. You have type 1 diabetes, which is an autoimmune diabetes. That means that your body has produced something that attacks the cells that make insulin. So these individuals don't have insulin, so they will always need insulin for treatment. You have type 2 diabetes. This is the most common cause of diabetes. So 90% of patients presenting with diabetes will have type 2, having an unhealthy lifestyle. The liver also makes too much sugar, and these patients usually have a relative insulin deficiency. So yes, they make insulin, but because of the insulin resistance, the insulin cannot work as effectively and leads to high sugars. These individuals are treated with oral medications, lifestyle, or they may need injectable therapies. You have gestational diabetes. So this is diabetes that occurs in pregnancy. The placenta makes hormones that result in insulin resistance. And these gestational diabetes usually resolves at delivery, so after the pregnancy is completed. However, these women have an increased risk of developing type 2 diabetes within 5 years. So you have monogenic diabetes, which is a rarer form of diabetes. So less than 1% of patients presenting with diabetes will have this type. This is due to a genetic defect in which there is an error in insulin release or in the cells that sense blood sugar.
So Dr. Martin, how can individuals become more proactive in recognizing the early signs of diabetes, and why is early detection important?
So as Dr. Davis-Simmons mentioned, when a person is diagnosed with prediabetes, for instance, that is reversible, and it is reversible through lifestyle changes. And we know that most of us, we make choices throughout the day with our food choices or lack of exercise that can lead to prediabetes or diabetes. And so it is important for persons to be proactive with making healthier choices with food, nutrition, the planning of their food throughout the day, the ingredients that they put in their food, how they prepare their food, and their portions, especially as it relates to carbohydrates. The American Diabetes Association advocate that we count our carbs. Carbohydrates are the main source of energy for the body, and a carbohydrate is made up of starch, sugar, and fiber. And so we encourage persons to eat healthier carbohydrates, those with a lower glycemic index, 55 or below. Those are the carbohydrates that are higher in fiber, which will decrease our blood sugar levels during digestion. And so some of the proactive behaviors we encourage at the Diabetes Center at Centerville Medical Center is that persons learn how to be more cognizant and mindful about food choices, and then to incorporate and exercise in their daily lives. Even 15 to 20 minutes of exercise per day will help to maintain and reduce your blood sugar levels and blood pressure and cholesterol. The American Heart Association recommends 150 minutes of exercise per week. That is simply 30 minutes each day for 5 days, and that will help to control your blood sugars as well. And so another area that we target, that we encourage persons to be proactive with, is not only your eating and your getting regular activity into your day, but also managing your stress levels. We know that this life can become extremely stressful. Everyone's pulling at us from day to day in some instances, but find time to be mindful, to sit quietly with self, and to help reduce the stress-related symptoms or headaches or heaviness that you may feel from the daily input of stressors from the environment. So those areas are extremely important to controlling your blood sugar levels. In addition to that, controlling your blood pressure and your cholesterol levels and your attitude.
Okay. This has been a great conversation thus far. Dr. Martin, Dr. Davis-Simmons, we have to take a quick break, but we have a lot more to talk about. You're watching You and Your Health. We'll be right back.
Doctors Hospital is reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Welcome back to You and Your Health. If you're just tuning in, I'm Alexis Burrows, Marketing Director at Doctors Hospital and today's guest host. On today's show, we are talking all things diabetes with Dr. Ariane Davis-Simmons and Dr. Jan Martin. Before the break, we discussed an overview of diabetes management and some of the misconceptions around this chronic illness. As we continue our discussion, let's take a closer look at how diet, physical activity, and other areas play into this issue. So Dr. Martin, you talked about this a little bit already, but is there anything else you'd like to add to the conversation around why diet and activity level are important in the management of diabetes?
Yes, certainly. Like I mentioned earlier, it is important for diabetics to learn how to count their carbohydrates, not necessarily calories, because you can be on a low-calorie meal plan, but if you're choosing the wrong carbohydrates that are high in starch and high in sugar, then you're not going to control your blood sugar levels. And so the American Diabetes Association advocates that we teach persons to count carbohydrates. And we use a plating method. The plating method I have in my office and which is used worldwide as it relates to nutrition management is half of the plate should be dark leafy vegetables. Vegetables that are full of fiber, less starchy, and then a quarter of the plate with your protein. I encourage patients to bake, boil, broil, or bake that protein with very little sauces, because sauces also contribute to increased carbohydrates and salt and sugar. And the other quarter of the plate should have your starchy carb. Now we know as Bahamians we like our peas and rice, we like our macaroni. I encourage persons to pick one, either a third piece of macaroni or a third cup of rice is the equivalent of that goes into that quarter plate for your starchy carb. And so we really encourage carbohydrate counting. Drink lots of water. Exercise is extremely important to reducing blood sugar levels. And as I mentioned earlier, the American Heart Association encourages to walk 150 minutes per week. That is simply 30 minutes per day for 5 days. That significantly reduces blood sugar, and it also helps with losing weight and maintaining our weight.
And I imagine the exercise also helps to distill like the stress levels as well, right? Because I know you mentioned stress is a component.
Yes, certainly. It helps to relieve stress because it releases endorphins, those good feeling endorphins. And I also mentioned that our attitude improves as well.
Right.
We sleep better. And so exercise regularly, incorporating regular activity into your week is extremely important to managing your blood sugars and managing your overall health and wellness and your mental health.
Yeah. So no more, you mentioned the plates, no more 2 meats and, you know, peas and rice, macaroni and potato salad on the same plate on Sunday. That sounds like that's
right.
out the window.
That's out the window if you want to. And you know, we can reverse prediabetes, and
Right.
Dr. Davis-Simmons will speak to this.
Right.
We can reverse prediabetes simply by getting active and watching the amount of carbohydrates we eat in a sitting and throughout the day. We snack a lot. Why are we snacking? Are we hungry? So these are the mindfulness activities
Right.
I encourage persons to incorporate in their lives as well as it relates to self-care.
Sounds good. All right, so let's go over to Dr. Davis-Simmons. Medication management is crucial for many people with diabetes. Can you provide some insights into you know, the types of medications that are available and the proper usage when you're talking about controlling or managing diabetes?
Yeah, so medications fall into 2 classifications. You have oral medications, which are tablets. There's various types of tablets, and they all work by a different mechanism of action to help lower your blood sugar. And you have injectables, which can be firstly insulin, and that comes in a long-acting or a short-acting insulin or mealtime insulin. And there are non-insulin injectables, such as Ozempic, Trulicity, Mounjaro, Byetta, and these work by helping your own body to make a little bit of insulin. They help you to make you feel full and can also lead to some weight loss. So what medications your doctor will choose for you is individualized, and that will depend on multiple factors, your age, what is your A1C, how high are your sugars, the cost of the medication, patient preference, or if there's any other diabetes complications.
Okay. You mentioned the A1C and you mentioned the sugar levels. So what is the importance of regular monitoring of the blood glucose levels? And then can you explain some ways that people can effectively track their progress?
Great. So in terms of monitoring, so when we talk about daily monitoring, that can be done through a finger stick using your glucometer, or you can use a continuous glucose monitor, which is a device worn on your body, which samples your blood sugar in the tissues. So this lets you know what is your blood sugar doing at that point in time. Knowing that is important to help modify what you're eating. So if you're seeing, oh, I eat certain foods and my blood sugar goes high, it helps you to know what foods to reduce. If you're on insulin or on other oral medication, it helps you to adjust the medications to get good sugar control. And then we have quarterly monitoring, which is done by testing your A1C. This is a simple blood test that allows us to know what has your diabetes control been for the past 3 months. And as a reminder, your A1C target should be 7% or less in order to prevent long-term complications. When we think about blood sugar monitoring, your fasting blood sugar should be 80 to 130 in the morning, and 2 hours after a meal it should be less than 180.
Okay, all right. So we'll wrap up this segment with Dr. Martin. You know, self-care can be very challenging. How can individuals maintain their motivation and overcome obstacles in their daily management routines when it comes to managing a disease like diabetes?
Self-care is important, and as I mentioned earlier, you know, incorporating activities that are mindful, healthy activities, making sure that you incorporate social relationships in your day, healthy relationships. And also we have persons who have been diagnosed with diabetes for a long time. They suffer from diabetes burnout because they become chronic. They've done all of what we're recommending to them as diabetic educators and their endocrinologists. They're testing, they are counting carbs, they're trying to maintain their weight, but yet their blood sugars can't get, their A1C can't get below 7. And so we refer to that as a burnout. They're emotionally exhausted. So we have our diabetes healthcare team at Doctors Hospital, Centerville Medical Center. I encourage persons, connect with your diabetic educator, and that's someone like me. Connect with your physician, your primary care physician. Explain how you're feeling. We also have a psychiatrist and a psychologist on our team. So we have some persons who are mentally challenged, The stresses in life has really gotten them down, and so they put their health to the sidelines. And so if they connect with persons on their diabetes healthcare team, they're able to become more motivated by sharing, and then we're able to share with them different mindfulness and activities that they could incorporate in their day to increase their self-care. So it's really taking responsibility, and the care that we offer is person-centered. It is about you.
And it's also multidisciplinary, as you mentioned, which I'm sure is very helpful as you look at something that's, it impacts the person on more than just the physical level.
That's right.
All right.
That's right.
Awesome. So I hope you guys are enjoying this discussion at home as much as I am. We will continue our conversation with Dr. Jan Martin and Dr. Ariane Davis-Simmons when we return. This is You and Your Health. We'll be right back.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 3 advanced facilities at Collins Avenue, Carmichael Road, in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Health. I'm Alexis Burrows, today's guest host. We are concluding our conversation about diabetes awareness with Dr. Ariane Davis-Simmons and Dr. Jan Martin of Doctors Hospital. As we wrap up our discussion, I'd like to discuss some of what may be the more under-addressed areas around diabetes management. So looking to you, Dr. Martin, how key is social support in the management of diabetes, and what options exist if someone has little to no support in their family or friend circle?
So like I said earlier, Alexis, social support is extremely important. And so a lot of times persons may mention that their family members are not involved in their care. We find ways to discuss what's going on in the family to get the family more interested in the care for the person, because diabetes is a personal walk. The person themselves are testing. They are seeing those numbers before their family sees it. And so we encourage family members to become involved in their care. In addition to that, as I said earlier, we have our diabetes healthcare team at Centerville Medical. It's made up of myself as the diabetes educator. We have Dr. Davis-Simmons. We have their primary care physician, psychologist, psychiatrist. In some instances, persons may be suffering from other psychological or mental health issues that needs to be addressed. There's also online support, diabetes support groups online. They're very active and they're very helpful to persons. And so we help them to navigate the scope of services outside of the home if they're not receiving that social support within the home. There are other services that they could navigate outside of the home to help them manage their illness.
Okay. And then what advice can you offer patients on the emotional and psychological impact of managing their diabetes?
There again, self-care, checking in with yourself daily, becoming more intimate with yourself. Into me I see. What is going on with me? How do I feel about this diagnosis? There are some persons who are newly diagnosed. When they come to sit with me, I address those issues. I address the anxiety levels that they come in with. And many times they are anxious. They are anxious, as Dr. Davis-Simmons mentioned, and they go to the natural end of what can happen with diabetes. But I allay their fears by saying to them that, self-care in this diagnosis is extremely important. And so if you begin to learn how to count your carbs and take care of your body, daily, then you can beat this diagnosis as opposed to the diagnosis beating you. And so allaying the anxieties. If the mental health is to the state that they need to be referred to someone else on our team, like our psychiatrist or psychologist, after those assessments, they are referred. I also like to encourage persons to bring their families in, especially if it is a younger person or an older person. We also have persons on our team for ophthalmology, and we encourage them to seek their annual eye health, dentistry, their annual twice visits to the dentist. And so helping persons to navigate the disease of diabetes, it's extremely important to their mental health, because as I said earlier, it is person-centered and all of us present differently emotionally.
Right. So Dr. Martin, you talked obviously a lot about the social support side. So Dr. Davis-Simmons, can you explain how patients can get the most out of their interactions with their physician as it pertains to their management of diabetes?
So if you have diabetes, we talked about monitoring. So if you're going to see your doctor, it's important to bring your blood sugar log so that they can review your blood sugars and help to make adjustments in your medical management. And also knowing your numbers. What should my numbers be? Knowing your health numbers. So as I said, if you're monitoring your blood sugar should be 80 to 130 in the morning, fasting, 2 hours after meals, less than 180. What is my A1C? The goal is 7% or less. What is my blood pressure? Is it at goal? So for patients with diabetes, we want the blood pressure to be less than 130/80. What is my cholesterol numbers? The goal total cholesterol should be less than 200. The bad cholesterol, known as LDL, ideally we want this to be less than 130 and in some cases less than 100. What is my BMI? Is my weight at goal for me? Am I overweight or am I obese? And if you are, just losing 7 to 10% of the body weight can improve diabetes. And if you lose more than 20% of the body weight, this can lead to remission of the diabetes. So these are some important facts to talk to your doctor about.
Okay. And I always like to end these conversations with a view to the future. So Dr. Davis-Simmons, what advancements are there, either in the recent past or on the horizon that you're excited about? It can be in the area of testing, treatment, or management of diabetes.
So diabetes research is an exciting field, and it's one of the growing research fields in medicine. In regards to new medications on the market, you have oral insulin that is in phase 2 trials. For individuals with type 1 diabetes, there is stem cell transplant, there is pancreatic beta cell transplants, which will help to restore insulin production in these individuals. You have diabetes technology that helps to assist you in managing your diabetes. So you have the sensors, which is a device that is worn on the body and helps to sample the blood sugars. It can then send the sugars to either your phone, your smartwatch, or to a reader. You have insulin pumps for those who are on insulin. That is an external device that is worn on the body, and it helps to administer insulin. You have closed loop systems where the insulin pump talks to the sensor, and if sugars are running high, it can help to reduce sugars. If sugars are running low, it stops insulin being released. So in conclusion, I'd like our listeners to know that no matter where you are in your diabetes journey, newly diagnosed, caring for a loved one with diabetes, or if you've had diabetes for a long time, it's important to know more about your diabetes, know how to develop a diet plan, healthy lifestyle, know how to take your medications, and being more educated. It's never too late to get in control of your diabetes and live your best life. And we at Doctors Hospital and our diabetes care team are here to assist you in living that best life.
Dr. Martin, Dr. Davis-Simmons, I want to thank you both so much for taking time out of your schedule today to join us for You and Your Health and for the in-depth conversation and information.
Thanks for having us.
For our viewers at home, for more information on diabetes management, you can call the Centerville Medical Center at 302-3250 or 816-7660 or visit clinics.doctorshosp.com to book an appointment. It has been a pleasure hosting today's show. Don't forget to follow You and Your Money on social media and tune in next week for another exciting show. Thank you for watching.